Welcome to the Health Zone. My name is Dr. Toju Chikiobi, but everybody calls me Dr. Toju. We have a wonderful episode today. We're going to be talking about infertility. Do you know that African women who are infertile are more depressed than their infertile counterparts in the rest of the world, in the rest of the developed world? And that is because there's such a cultural stigma associated with infertility here in Africa. Today, we're going to have an amazing obstetrician gynecologist with us who will talk to us about infertility and tell us all the things that we need to do to avoid the risk of being infertile and what we should do in the event that we are infertile. So please don't go. Join us. This is going to be well worth your while. Welcome to the Health Zone. We have a really good show today. We're going to be talking about infertility, and we have a special guest with us today, one of our returning doctors. Her name is Dr. Chito Umana. Dr. Chito is a board-certified obstetrician gynecologist, and she's also the medical director of Tabitha Medical Center in Abuja. In addition, she is the chairperson of the Guild of Medical Directors of Nigeria, Abuja chapter. She is passionate about everything to do with women's health, and she's huge in community outreach, empowering people in the community to adopt good health principles for disease prevention. We're really honored to have her with us here on the show. Dr. Chito, welcome to the Health Zone again. It's good to have you back.
Thank you, Dr. Toju. Thank you for having me.
And as is our custom, you know this because you've been with us, we will now go out to the man and woman on the street to find out what they know about infertility. You know that we love children, we love babies here in Africa. And if there's any reason why a woman can't conceive, it's a huge deal. So let's go out and find out what men and women out there know about infertility. Don't go away. Let's watch the video together.
Today we'll be talking to the man in the street. What do you know that infertility is?
Well, infertility means that on my own side, I believe infertility is like somebody that I cannot really
wants to do some
produce very well.
Casually.
As either a female, or it can happen to a female or a male.
Somehow,
okay. And what do you think causes infertility?
I don't know.
I guess lack of some hormone system in the body.
Who do you think is more common in men or women?
Men.
It's more common in the women of nowadays. We the men, we are agile. We are
strong.
Yeah, strong. Yeah, we are the man.
Many infertile women in developing countries actually believe that without children, their lives are without hope. And so in an area of the world like sub-Saharan Africa, where there's explosive growth because of so many children being born, you have women who experience what is described as barrenness in the middle of plenty. These are women who see children around them all the time, but are unable to give birth themselves. Dr. Chito, we're talking about infertility today, so tell us exactly what is infertility.
So infertility can be defined as not being able to get pregnant despite having frequent, and I emphasize frequent, and that's about 3 times a week, unprotected sex for at least a year. And I emphasize a year because we're in a society that people think they're infertile much, earlier than a year. Yeah. So there are 2 types. You have the primary infertility, where the woman has never ever had a baby before, then that would be considered primary. And secondary is when you've had a baby before but having difficulties in having your next child, and then that would be considered secondary. So globally, it's 15% of reproductive age women that suffer from infertility. What we see in sub-Saharan Africa is that is more secondary infertility, and that's about 30 to 40% among women aged 25 to 49.
Infertility is often considered a woman's problem. So is it really just a woman's problem?
1/3 is male, 1/3 is female. The remaining third, it consists of complex factors, maybe combined with the male and the female, and 20% of that remaining 1/3 is unexplained, meaning we don't have a reason why that person is suffering from infertility.
So Dr. Chito, what causes infertility?
Well, when we want to think of causes, we start by trying to go down the path of how one gets pregnant in the first place. So first of all, the male has to produce healthy sperm. Second, the woman has to produce healthy eggs. And for them to be able to fertilize, they have to do so in the tube, the fallopian tube of the woman. So you want to make sure that tube is unblocked and there's a clear path and is functioning. So we want to make sure that tube is normal so that they can fertilize. Then when they fertilize, the next step is for it to now get implanted in the uterus. So that means the environment of the uterus has to be right for the implantation of what we call at that point the blastocyst, and that's just the fertilized egg and sperm. Then after that, for the embryo and that's what is formed after that, to stay as a normal pregnancy, the hormonal environment has to be normal to be able to maintain the pregnancy. So when you look at it step by step by step, you find out that, that's how we actually also, when we get to it, try to do our tests, okay? And the most common cause of infertility in women normally is ovulation disorders. That means ovulation means when the egg is released. So anything that has to do around the egg being released is the most common form of infertility. And then one thing that comes to mind that is commonly we normally note is polycystic ovarian syndrome, which is a topic on its own. And then for men is usually what we call azoospermia or oligospermia. So azoospermia means when they don't have any sperm, and oligospermia means when they have very little. I'm just talking about the common causes. There are other causes, of course.
So what are the things that can make a woman more likely to become infertile?
One is age. The older you grow as a woman, your ovaries are not as healthy your eggs are not as healthy as they were when you're younger, and they're not as many. And also the eggs are not released as easy as when you compared to when you were younger at age. So that age is really a significant.
What age are we talking about here?
Well, most times, honestly, by the time you get to your 30s, your eggs do start reducing. But I think when I personally get nervous when you're above 40, then you most likely consider that your fertility definitely drops significantly. Doesn't mean you can't get pregnant, because a lot of women in their 40s getting pregnant, it's just harder to get pregnant. So therefore, predisposes you to, having to be evaluated and treated for infertility. The second one is infections. So if you have multiple partners in life and you have a lot of history of having sexually transmitted diseases, and especially chlamydia, then you have a risk of having damaged tubes, blocked tubes as they call it, and that of course will obviously make you difficult for you to get pregnant, because the tubes are needed for the egg and the sperm to fertilize. All right. Smoking, again, so really that's lifestyle. Smoking, alcohol, excessive smoking and alcohol, again, also will reduce your chance of getting pregnant. And another one people don't talk about is severe psychological stress. And I think it's one to talk about in this environment, because it's like a vicious cycle. You're so stressed about not getting pregnant so early. Again, you find people that are married for 3 months coming for fertility workup. You're so stressed about not getting pregnant, then you're actually going into a point where you can get to extreme stress where your periods start becoming irregular or sometimes even disappear if it's extreme. And that, again, will prevent you from getting pregnant and reduce your chances of being fertile, and therefore seeking medical care for infertility. So those are the ones I can think of now, off the top of my head. I'm sure maybe
What about obesity?
Obesity, definitely. You know, and obesity at both two ends. Anorexia, like being extremely underweight and being overweight, are also risk factors for infertility. The reason being that in obesity, one is that you don't. You have your fat tissues also make estrogen. So where obesity has a problem is in ovulation. It affects your ovulation, causes ovulation disorders. Even in PCOS, commonly obesity is linked to polycystic ovary syndrome.
Yes.
You know, and when you're underweight or severely malnourished, your periods go away. Therefore, you are definitely at risk for infertility.
So we've talked about what causes infertility, what makes a woman more at risk to be infertile. Let's talk about the same thing for men. What sort of things would make a man more predisposed to be infertile?
One of the most common causes for male infertility is poor sperm quality, and some of the causes of that is like varicocele, which is dilated veins that normally, you know, are harmful to the sperm. Then you have medical conditions like diabetes, trauma, infection. Even when they go for chemotherapy, radiation, you have unhealthy habits like the women heavy alcohol use, smoking, and even toxins in the environment like pesticides and lead.
Okay. What sort of tests can be done to figure out where the problem lies?
So the test that we do, when I talk, we can go back to how I describe the causes, or you know, of infertility, starting from the eggs, the sperm, and that's pretty much how you test. So for the woman, how do we assess for healthy eggs? One of the things we do is do some hormonal tests that allow us to know how healthy the eggs are, how many eggs the woman has like reserve. So we have a lot of hormonal tests that we do. Another thing that we test for is that we look inside the uterus to see if the uterus has any fibroids or polyps. And the way we do that is by a special x-ray called hysterosalpingogram. That's a long word. We just say HCG. Another thing we can also do is what we call laparoscopy, hysteroscopy. And that's really minimally invasive surgery in itself. And that gives us direct visualization.
So you look in.
Laparoscopy,
yourself.
we go from the abdomen with a little hole and just look in, and we can see the tubes. We inject dyes into the womb sometimes, and then we see if it spills out of the tubes, and we know, okay, it's open. Hysteroscopy doesn't need any incisions. We just go through the vagina into the womb, and then we can look directly to see if there's anything like a fibroid or a polyp. For the men, we do semen analysis. That's always important, and that's actually very hard to get sometimes. As you said, men never like to feel that they're guilty of or part of this process.